Adam, it's nice to meet you.
Nice to meet you as well.
You are a respiratory therapist.
Yes, sir.
At Veterans Affairs. Can you tell me about the specific support you give for people with ALS who have invasive ventilation or trachs?
It's an early on discussion once we get into diagnosis and then meeting with a neurologist and pulmonologist. At that point, we start to discuss what direction the family wants to go in and get that conversation going on early. Just knowing that if the decision is made to go with invasive ventilation, that there is a lot of challenges that come with that, a lot of education, and a lot of hands-on activities to become comfortable with being able to leave a facility that has all that support around you to then leaving and coming home and you're the only support or the spouse is the only support.
Once the surgery has been done, what kind of support do you provide then?
So it comes pretty early. Right after surgery, within about 24 hours that we deem the patient to be medically stable, that's when the education starts with the caregiver or the spouse. And that's not just sit down and let's talk about it. It's time to put your hands on and dive in, because in my opinion and what we've learned through the years is that hands-on education, it actually has a better outcome than just text education.
All of the supportive equipment for someone with ALS, with or without invasive ventilation, is a bit intimidating. When you add the tracheostomy to that, it can feel to an outsider a little bit, or someone who's in early stages of ALS, a bit intimidating. What's the learning curve for working with the machinery and the techniques that are needed to make it work?
Well, there is a big learning curve. I mean, we're talking about a critical care or a life support piece of equipment. It takes some time. I can tell you that we have been successful with getting patients and caregivers trained within a 2-week process and back home. And then there's times where it takes a little bit of extra time, but we're there to provide support and to not rush anybody out the door. We want to make sure that once you leave the hospital that you're set up for success, and that we're not looking to see you come back. We want to keep you in your home. In my opinion, it's all about the quality of life and where the patient wants to be, and home is usually where we want to be.
Can you talk a little bit about the risk of infection and other complications with a trach?
The issues that we run into with having a tracheostomy is it's a direct route into the patient's lungs, and so we really want to worry about pneumonias. With the advanced airway that's placed, the actual trach, it has a balloon on it that helps protect the patient's airway from possible aspiration, because that's one of the biggest challenges we run up against is ventilator-associated pneumonia. So it's a big thing. So proper technique with suctioning, proper technique when doing the tracheostomy care, it's key to staying in the home.
I have heard 4 or 5 different ways to describe invasive ventilation, tracheostomy, tracheometry. What is it? Help me out here.
You hear trach, I think that's just kind of a slang, a shortened version of tracheostomy. You do hear tracheotomy,
right.
But I mean, essentially, as a respiratory therapist, you could say either one and I'll know what you're talking about. So.
All right. What are some of the daily maintenance issues involved in a trach?
Yeah, so along with having the surgical procedure and an advanced airway placed, there's daily routine maintenance that comes along with that, just like anything else. Daily care of the tracheostomy, trying to keep it clean and dry, will help decrease potential infections and pressure ulcers. Suctioning, which is an inline catheter that actually goes through the tracheostomy into the patient's lungs and then hooked to negative pressure so we can evacuate secretions from the patient's lungs. There's lots of other mobility, turning, rolling, especially if somebody's bedbound, but everything revolved around anything you do, the trach is your #1 priority, because that's your life support right there.
And the suction that you just referred to is important because for those of us who opt for a trach, we can no longer clear our lungs independently.
The disease process and then attacking our nervous system, neurological system, and our muscles, we lose the ability to cough very strongly like we normally do right now to clear our lungs. And so once you lose that ability, we have to be able to evacuate those secretions somehow, some way. And so the best method is to do an inline direct suctioning of the patient's lungs.
Do you have any additional advice for someone like me who's in early stages of ALS, who's weighing some of these different options regarding respiratory support?
Yes, I would say the biggest piece of advice I could give you is have a plan. Speak with your family, and it's a plan not just made by you, it's a plan made by your entire family. Know what you want to do, because you don't want to be put in a situation to where somebody else makes that decision for you. So that would be my biggest piece of advice.
Thank you. That's very good advice.